Alaikum wa rahmatullah wa barakatuh. My article for this week is titled Flare-ups After Non-Surgical Retreatments, Incidence, Associated Factors and Prediction, which was done by Dr. Ali Nosrat, Dr. Ashraf Fuad and others, and was published in the JOE in 2023. The article discusses the goals of endodontic treatment, which include eliminating tooth pain and infection and providing a healthy pre-apical condition. According to a thesis in 2008, flare-ups are defined as post-operative occurrence or exaggeration of intense pain and or swelling after the initiation of endodontic treatment, and they can negatively impact both patients and clinicians. Management of flare-ups can be complicated, and there are few studies on their incidence and factors associated with them, especially in cases of non-surgical retreatment. This retrospective cohort study aimed to determine the incidence of flare-ups following non-surgical retreatment, determine factors associated with the flare-up following non-surgical retreatment, build a prediction model for flare-ups based on baseline risk factors. Moving to materials and methods, a flare-up was defined as moderate to severe pain with or without swelling that took place within 14 days of initiation of non-surgical retreatment and resulted in unscheduled treatment appointment. 3,666 patients who received non-surgical retreatment by 3 endodontists in 2 private practices within a period of 6 years from 2016 till 2022 were included in this study. The intensity of pain on percussion and palpation is recorded using the 4-point verbal rating system. A 4-point verbal rating system is used for determining patient's pain level: none, mild, moderate, and severe. Treatment of the flare-ups depending on the sign or symptoms presenting at the time of flare-up. A series of treatments were provided to manage the pain or infection: reaccessing the root canal system for further cleaning and shaping, and for allowing drainage through the root canal system, incision for drainage of a swelling, prescribing antibiotics and pain medications. If it was done when the treatment was initiated, root end surgery in cases of a persistent and repeated flare-up, and referring the patient to hospital emergency room or oral surgeon for further systemic assessment or extraction of the tooth when the patient developed facial space infection. Data on demographic: age, gender, medical history, high blood pressure, history of diabetes and allergies, self-reported pain level, tooth type, diagnostic pain levels on percussion and palpation, pre-apical diagnosis and procedure factors, preoperative CBCT, incision of drainage, number of visits, incidence of flare-up were collected and analyzed by variety analysis on the entire cohort and multivariable analysis on the cases with complete data set were performed to identify significant associations. A random forced algorithm was performed to make a prediction model. Regarding the results, the incidence of flare-ups was 3.95%, and most flare-ups were managed by reopening the tooth, incision for drainage, and prescription of medications. Increased risk of flare-ups was associated with diabetes, mandibular teeth, moderate to severe preoperative pain on percussion and pain on palpation, and lower risk of flare-up was associated with high blood pressure. The prediction model was not able to predict flare-ups with sufficient confidence due to rarity of flare-ups. As a conclusion, incidence of flare-ups following non-surgical retreatment was low, around 4%, and had a weak but significant association with a history of diabetes, moderate to severe pain on percussion, pain on palpation, and mandibular teeth had a significant association with flare-ups. A history of high blood pressure was associated with lower risk of flare-ups.